Well, thank you so much for joining me. Today I'd like to talk about healthy places or planning for healthy places. Andre, perhaps you can just tell us a bit more about that.
Yeah, sure. In terms of planning for healthy places, I always think that the most important thing for us to think about is that ultimately we are planning for people. And it is very important, therefore, to actually place people and their aspirations and the way that they actually relate to the environment in the center of the planning process. In order for us to be able to do that, we need to actually understand how choices are made and how we can actually shape those choices in order to make the healthier choice the easiest choice. So I think that is really the key theme and the key thing to bear in mind when you are planning for healthy places. In this space, PHE has actually recently published a Spatial Planning for Health evidence resource that touches on 5 key themes that we believe are essential for planning for healthy places. Those themes are healthy housing, healthy food, access to healthy food, a natural and sustainable environment, active transport, and healthy neighborhoods. That evidence resource actually looks at the linkages between planning on those themes and how strong the evidence is around the links between the built environment and health.
Okay. Jamie, I'd just like to bring you in there to talk perhaps about some of the challenges involved in planning for health.
Sure. I mean, for me, the biggest challenge, I think, is managing to give health and wellbeing the priority it deserves in the planning hierarchy. There's already support in the MPPF for it and the MPPG, but the extent in practice to which that's given the same weighting as other planning policies varies. And I think there's a lot of work to be done on that, and I think it also works on a planning officer basis as well, because planning, as a planner, you have a social role. You don't just simply have a role to facilitate development. You have a social conscience, and I think planning has that side to it, which possibly has been neglected in recent years. And I think the real danger is, with the drive for housing numbers going up, pressure on local authorities to deliver more housing, that role gets forgotten about. So I think it's absolutely critical that it stays as an important point.
I can see you nodding in agreement.
Yeah, no,
there,
I absolutely agree with Jamie's point, and I think that is one of the essential pressures and issues that planning is facing at the moment. It's this balance between quantity and quality, and I think that, considering it from a health perspective, I think that we have been very much concentrating on quantity, and I think that recently there has actually been a shift in that mentality, and I think that we are now recognizing the role that planning can actually have in terms of delivering quality places that obviously is going to have a huge impact in terms of health and well-being for the population.
Yeah.
So just staying with that sort of quality place, what's a healthy place? What does it look like?
It's very hard to define, but I would say that as a starting point, the 5 key themes that feature on the evidence resource that PHE has actually done are probably a good place to start. So we looked at space holistically and actually thought about what are the key things within the planning process that will have a very, very strong impact on health, and what can planning influence in terms of changing those. And we actually went through them quite systematically and look at the strength of the evidence between those links and its impacts on health. So I would say that that's probably a good place to start in terms of understanding how the built environment as a whole can influence and shape health and well-being.
Are there any particular examples that we should be looking at?
We're always looking for evidence to support our policies, so I think it's really, really important that there is that emphasis and that data that backs it up, and that should then feed into local plan making.
Yeah, absolutely. Hopefully the resource will help to achieve that.
Yeah.
So what sort of projects are out there that people are looking at the moment?
I think that in the last couple of years, a little bit like Jamie was mentioning, I think that there is an increased awareness and understanding of the social responsibility and the social role of planning, and that is reflected, I think, in the amount of projects that are out there that look at this specific agenda. So, for example, if we look back at the eco-towns, that was, a project that obviously, although it was focused on the eco and sustainability side of things, actually had a huge impact on health as well, because when you plan for sustainability, you plan for health and well-being as well. But recently, a lot of more projects have actually been coming up on this specific agenda, such as the Healthy New Towns, the NHS England project, and also the Garden Cities and Villages.
Yeah, I'd just like to bring Philip, who's in our team at Citiesmode, in on that point. We've been working on a project around healthy new towns, actually. Philip, do you want to just tell us a bit more about that?
Yeah, we've done a project on healthy new towns where we came up with 15 projects that we thought would help an area called Halton, which is in northwest England, which is a new town, and we came up with projects that was centred around the person, as you were saying, that planning should be around people, and this is how we can get better health outcomes if we plan for people. So one of the projects was about bikes for homes, where we have developers actually provide bikes for people when they buy a new home. And we've seen this in London. I can think of one example where a developer has offered cars for anyone who buys a home. And I don't see why we can't do that for bikes, which take up less space and would probably be a lot easier to buy than cars. Another one was about an innovation called multi-generational housing, because we haven't quite touched on this yet, but we were thinking about mental health as well, where you have residential care homes, which could have a mix of ages living in these developments. And the benefits there would be that you'd have young people living with older people, and that they would have daily interactions with young people. And I think that's an important thing that we could be thinking about when talking about planning for healthy people, for places.
Fantastic. Well, clearly a lot of interesting research and evidence growing in this area, and I think quite rightly it's not something that's about to go away as we start to look at bringing health into the heart really of planning. Well, thank you so much for your contribution. That was a really interesting discussion, and I hope to see you all again very soon.
Thank you.
Thank you.